Hello and welcome to a quick Dooley Noted video on organ referral. So organs have a visceral afferents, a dull kind of achy pain that's difficult to localize, but we can localize it in some parts. And we should know these in case you're getting some organ referral that you need to differentiate from peripheral nerve referral or even radiculopathy associated with the spinal nerve. So some of the organs of referral, particularly for men, will be the heart here and into the inside of the brachium, forearm and fifth digit onto their left side. Females will tend to only get the pectoral region or central chest pain. For the lung, it will typically be a little bit more towards the left side of the nape of the neck. For the diaphragm and the pericardium, it'll be more on the lateral side of the left arm. On the right side arm, you'll have into the forearm, nape, inside of the shoulder, you'll have liver and gallbladder on the right side of the body here. And liver and gallbladder can also refer at the right side, ninth costal cartilage area, over in towards the posterior part of the trunk back here, and even to the inferior angle of the scapula. So just to review, heart, lung, pericardium, diaphragm, liver, gallbladder, liver, gallbladder, liver, gallbladder. Moving on, you have the esophagus, which often gives you heartburn because it's on the back of the pericardium. So you have that here. Centralized chest, even situated tiny bit over towards the right. Then right at the xiphoid area, central pylorus will be stomach referral. And then over into the left side, below the costal margin, will be more pancreas. The pancreas also refers to the posterior area here. So again, to review, we've got heart, we've got lung, pericardium, diaphragm, liver, gallbladder, liver, gallbladder, liver, gallbladder, esophagus, stomach, pancreas, pancreas. And then we have some referrals from the intestines. On the left side of my body here, I'm going to have more jejunum, paraumbilical area. Right lower quadrant for paraumbilical area will be more ileum. That'll lead us to the cecum and appendix at McBurney's point, a halfway point between umbilicus and ASIS. Right? So jejunum, more left quadrant. Right quadrant is more ileum. Right lower quadrant, cecum, appendix. And then we move into ascending colon on the right side, upper anterior flank, transverse colon across, and then descending colon. So we've got jejunum, we've got ileum, we've got cecum, appendix, ascending colon, transverse colon, descending colon. That leads us into the lower left quadrant, sigmoid colon, and then rectum and colon can also refer deep underneath the umbilicus. So just to review the intestines again, we've got jejunum, ileum, cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum. If we're starting from the beginning, got to have our fun dance, right? We've got heart, lung, pericardium, diaphragm, liver, gallbladder, inferior angle, liver, gallbladder. We've got esophagus, stomach, pancreas, jejunum, ileum, cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, and then centralized for the rectum. Now don't forget the urinary pathway. We've also got urinary bladder in the suprapubic region above the pubic symphysis and even at the level of pubic symphysis. Then you got the ureters, which will refer a little bit more to the medial thigh area. And then you've got the kidneys, which will go from low back to the sides of the hips, right? They'll even include the flank. Sometimes you'll feel deep pain at the costovertebral junction. So kidneys, urinary bladder, ureter. All right, are we ready to do our dance from the beginning? Let's do our organ referral dance. Here we go. We've got heart, lung, pericardium, diaphragm, liver, gallbladder, liver, gallbladder. We've got esophagus. We've got stomach, pancreas. We've got jejunum, ileum, cecum, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectum, urinary bladder, ureter, kidney costo, kidney lumbar, kidney anterior lateral thigh. Hopefully you guys can learn the dance and know your organ referral is different than your somatic referral. Make sure to look for red flags as far as organ signs, and I hope you found this helpful.